Hello, everyone, and welcome to the fourth episode of our technology webinar series. Today, we're going to be talking about telecommunication via the FAM Connect app. That is something here at Omni-Health we've developed on our own, specifically to address the aged care social problem in Australia. And it is designed with the objective of supporting people living on their own. You could be an elderly person or not an elderly person, but we took the elderly community as our primary target market to support them with being able to increase their social interactions and also able to increase their ability to communicate with their health practitioners and GPs who might be in a more remote location. And with that, I'll pass it to April, who will take us through this week's episode.
All right. Hello, everyone, and welcome to the fourth session of Omni-Health online demo. So we're excited to share how technology is reshaping the way we connect and care in aged care environments. And today, we'll explore FAM Connect app, which is our latest innovation that integrates seamlessly with TEMI, the personal robot companion, to bring families, residents, and healthcare teams closer than ever before. So let's begin by understanding the everyday challenges faced in aged care. First is social isolation. Residents often feel lonely or disconnected, especially when families live far away or can't visit regularly. And second, it's mobility and accessibility. Imagine being asked to hold a tablet for a 20-minute video call when your hands aren't steady or your vision isn't clear. It's frustrating and exhausting. And third, staffing constraints. Our care teams are superheroes, but even superheroes can't be everywhere at once. Assisting residents with calls takes time away from personal care. So here's the big question. What if technology could solve all these three challenges at once? This is where innovation steps in. The FAM Connect app, integrated with TEMI, offers a simple yet powerful solution. Imagine this: a family member books an online meeting with a resident through the app. Just a few taps, no coordination headaches. At the scheduled time, TEMI automatically moves to the resident's location and starts the call. The resident doesn't touch a thing. If the resident decides to take a walk or move to the lounge, TEMI simply follows, keeping the conversation alive. And because everything is done with a secure platform, there's no risk of privacy breaches or lost connections. So what we have is more than a call, it's connection made effortless. Now you might be wondering, does this actually work? Let's look at the research. Study shows that telepresence robots significantly reduce social isolation by helping residents connected with their families. Healthcare providers benefits too. These robots help save staff time and enable remote consultations, so carers can focus on what matters most: people, not devices. And residents, they report feeling happier, calmer, and more engaged because every interaction feels personal, not technical. So the results are clear: less loneliness, less workload, and more smiles. Let's watch a short video on how the FAM Connect app works.
Imagine a world where distance is no barrier to care, companionship, or expert medical advice. Telepresence robots are making this possible in aged care facilities. The FAM Connect app features a user-friendly interface that is simple and easy to navigate, both in TEMI and mobile app. Imagine a scenario where a granddaughter hasn't seen her grandmother for a while. She schedules a visit through the FAM Connect mobile app. In the mobile app, she receives reminders of the meeting, also when the call is starting. Since the granddaughter lives far away, she connects with Grandma Lily virtually. Through easy scheduling in the FAM Connect app with TEMI, they can enjoy activities and chat together in real time. The granddaughter can control the robot in locations assigned to the resident's profile, with residents or families able to nominate multiple locations. Now Grandma Lily requires regular specialist follow-ups. Travel is difficult, but with a telepresence robot, her doctor can conduct checkups remotely, review her vitals, and adjust her treatment, all without leaving the facility. The specialist scheduled her checkup via the FAM Connect app, and the telepresence robot traveled to the resident's assigned location. The specialists can control TEMI to navigate the environment and approach the resident. And that is FAM Connect app. Enhancing care, connection and efficiency. It bridges the gap between residents, families, and healthcare professionals. The future of aged care is here.
So what you just saw is a simple demonstration of how telepresence robots are transforming aged care facilities by bringing physical distance with real human connection. They allow families to stay emotionally close to their loved ones, healthcare specialists to provide timely checkups without travel, and staff to focus more on meaningful care instead of coordination tasks. Ultimately, telepresence robots enhance the quality of life for residents while improving efficiency for care providers. It's not just about technology, it's about bringing compassion, connection, and expert care together in one innovative solutions. Now let's compare the old way versus the new way, and I'd love to hear your thoughts too. With a regular call, what usually happens? Staff fetch the tablet or mobile device. The resident struggles to hold it steady. The call ends early because the sound isn't clear or someone gets disconnected. Now, imagine the FAM Connect app experience. Temi arrives on its own, starts the call automatically, adjusts the right height, and moves it if needed. No devices, no frustration, just natural engaging conversation. So I'll ask you this. Which experience would your residents prefer? Now it's time for the Q&A, but first let me share a few questions that often come up. Just this might be the same ones you have in mind. There's one question. What are the main features that make this technology suitable for aged care facilities? Well, Fund Connect app is equipped with features specifically designed to enhance communication, efficiency, and care delivery in aged care environments. Plus, it is integrated with the personal care robot TEMI. It is number one, effortless scheduling. With just few taps in the mobile app, families or healthcare providers can easily schedule virtual visits. No complicated setup required. Users simply register through the app, and once the facility staff reviews and approves their access, they're authorized to connect directly with the assigned resident. And also, it has a remote navigation. The authorized users can control the robot's movement remotely, allowing them to visit residents or conduct assessments without being physically present. They can also move around the facility using a follow me mode with the resident when the resident wants for a walk. It's like participating in a real-time activity. It also a hands-free two-way video and audio communication, enables real-time natural conversations between residents, family, and care teams without any physical effort. Residents can communicate comfortably without holding a device, making interactions more enjoyable. And lastly, of course, it's a user-friendly and easy access interface. The app is designed with simplicity. The system ensures residents and staff can operate it with ease and hassle-free. You don't need to be a tech savvy to access and use the app. And even the residents would feel stress-free and will not be confused because they will not only going to see and hear the user on screen without touching any buttons. And there's another question. How would the family members or healthcare providers or specialists access the app? Well, the access is a role-based. It has an admin and the user. Admin access typically assigned to facility staff that manages residents' profiles, assigns permissions, and monitors overall system activity. They can approve connection, requests from family members or healthcare providers to ensure all users are verified and authorized. And the user access includes the family members, healthcare providers, and specialists. They can schedule a call, navigate smoothly in TEMI, and even visit of the nominated areas of each resident profile. All interactions occur within a secure, encrypted environment that complies with privacy regulations. The system ensures that each user only sees information relevant to their role, maintaining both confidentiality and collaborative efficiency. So going back to you, Shorsen, do we have any other questions?
Yeah, we've got a few questions that have come in. So one of them is from someone who works in a residential aged care facility. It's a two-part question. It says, does this mean that each resident needs to have their own robot? That's the first part. If they do not, how do you ensure that someone calling in doesn't accidentally call the wrong resident? Okay, so firstly, definitely not that you need to have one robot per person. You can have as many people as you want in a residential facility. If you've got 60 residents and you've got one robot, one TEMI, that's not an issue, because anyway, the way it works is it's a calendar booking system. So someone books in only if there is an available time slot, which means no one else is booked in during that time, and the robot hasn't been assigned to do any other tasks like its reception duties. So it's not a one-to-one in terms of robot to resident. And the second part, since it's not a one-to-one, how do you make sure that family members who are calling in don't call up the wrong resident? Well, that part is very simple, because when a family member sets up their account on their mobile phone, the facility needs to connect them only to their relevant family member who's the resident. So if I were to be trying to call my father in the facility, I'll not have the ability to call anyone else. I'll only be able to book in an appointment for my father who's in the facility. And so I don't need to be concerned about accidentally calling the wrong person, and the facility staff don't have to be worried about a resident getting a little bit distressed or confused because someone they don't know is calling them. So that's all built into the workflow and the experience to make sure that's not a problem. Another question has also come in. How do I prevent strangers from calling my family member? Again, same thing, because you have to create your account on your mobile device, and then the facility staff have to connect the family member to the resident. There's no possibility of strangers accidentally calling in that sense. And then how will the robot know which room my family member is in? So the way it has been designed is, when I want to call my father and I go in to book an appointment, when I book an appointment, I can only book it with him. That's yes, has been explained. And when I book it with him, the system already knows which room he's in. So at the time of the appointment, of the phone call, of the video call, the robot will know that it has to move to room, say his room is room 101, has to move to room 101 because that's where Suresan's father is. So that is all part of the setup behind the scenes in the system. So that is how it knows which room. So when we set it up, what we will make sure we do is we say, if it's Suresan's father in room 101, we do that association between Suresan's father, room 101. And if it's April's grandmother in room 211, then that association is done. April's grandmother, room 211. And then Suresan is only able to call Suresan's father, and April is only able to call April's grandmother. And all of that setup is done behind the scenes so that neither the resident nor the staff nor the family member calling in need to worry about a mix-up or going to the wrong room or calling the wrong person. Those are the questions that have come in April. We don't have any other questions.
I have one last question here, Suresan. Are there any upcoming upgrades or features? Well, as the needs of aged care and healthcare facilities continue to evolve, we at Omni-Health is committed to ongoing innovation. Future upgrades will focus on enhancing the app's functionality to better align with each organization's unique requirements. And this includes improved user experience, integration with other healthcare systems, and customizable features that allow facilities to tailor the robot's capabilities to their specific workflows and resident care goals. Well, if you have any other questions in mind, feel free to email us or give us a call. We'd be happy to discuss how we can provide the best solution for you.
I think April, on
Mm.
that point, sorry, I just wanted to add as well
Sure.
that in terms of new features that are coming out, it's important that everyone understands FAM Connect was developed with, here's the problem statement of social connection in Australian aged care facilities. And that's when we started its development. So again, new features would be, we want to hear what the real world challenges are, what are the enhancements that would make a person living on their own or a person living in a residential facility, what would make it easier for them to socialize and connect with their caregivers if the caregivers are remote. And so all our features, I think our roadmap is based on getting that feedback and then saying, yes, this addresses an issue. And we are not going to be going through a process of saying, we're just creating features and then saying, these are nice to haves. FAM Connect was born purely out of, there is a social interaction need here. Let's address it. And it will continue to develop based on that logic.
Yeah, that is so right, Shirisan. So now we're talking about the other solutions that we're providing at Omni-Health. Our mission is to bring innovative technology solutions into aged care and healthcare, from cleaning and service robots to personal companion technologies. Each solution is designed to ease workload, enhance safety, and most importantly, improve the quality of care. If you'd like to learn more or experience our solutions in action, feel free to connect with us after the session or visit our websites, omnihealth.com or temi.au. Thank you for your time and for being part of the journey to make aged care smarter, safer, and more connected. And on your screen, you can see our contact details. You can contact me, April, or Shurzen. And thank you once again, and we look forward to partnering with you on this exciting journey towards smarter care. Thank you and have a nice day.